And so as we look to then take what we've seen and ask a question, well, what's happening around our country? It opens another conversation, right? So, how are we doing in our attempts to identify congenital CMV early, given the numbers that we see? And really, the decision right now is at the level of the states. There has been some discussion and an attempt to have federal intervention in making this a reportable disease consistently, but that has not gained the traction many would like to see. And so presently, there are about a third or so, I believe 17 or 18, the last I checked, states that have decided that CMV should be something that education and or screening should be provided. We'll take a look at some of these just as illustrations of what is happening. And because I'm here in Florida, we've chosen Florida as one. The legislative initiative here in Florida was really a result of stakeholder discussion and deliberation prior to the introduction of this. Parents and caregivers united, and there was bipartisan support. And so in April of last year, a bill was signed that was implemented in January of this year. The majority of Florida births happen in the hospital, and this particular piece of legislation, Senate Bill 292, was partnered to the newborn hearing screening process that occurs. And so if a child fails at birth, by the time they've turned 21 days of life, they should have their CMV testing if their newborn hearing screen was a referrer or fail. For those children who are born at birthing centers or home births with healthcare providers in attendance, referrals within 7 days should be made for this. And when results become present, they should be reported to the Department of Health within 7 days. Of course, the prototypical and original cytomegalovirus legislation started a decade ago in Utah. And this was an effort similarly by elected officials, public health professionals, clinicians, and parents to advocate for this change to happen. It was a combination of both an educational campaign for the public at large, but also employees that were in areas that were higher risk. And then similarly to what Florida patterned after, when there was a newborn hearing screen failure, that child was directed to be tested for the presence of CMV. Now I have in plus here, or in parentheses plus, because Utah has since moved largely to a model where there are other higher risk types of findings that would result in a child having CMV screening as well. And while that's not part of the bill, it has certainly been adopted by the largest parts of the healthcare organizations in that state. Another example is universal screening. When we referenced use of the blood spot card, Minnesota has led the direction in this with their Vivian Act. It also has an educational component to it, but essentially every child who is born and has the Guthrie card collected will have CMV testing obtained on that. The actual decision by the legislative government was to refer this to the Department of Health and the commissioner. And after having a conversation as the health leaders of the institution, their advisory committee on heritable and congenital disorders decided to include testing for CMV on the newborn hearing screening panel for the state of Minnesota. All these states, of course, are going to be influential in showing what and how these new enacted pieces of legislation work. Finally, and many of you have probably heard some of this back in June, which, by the way, is National CMV Month. The intention of one of the senators, Senator Blumenthal, to promote a federal level CMV bill. In June, Senator Blumenthal announced that he would introduce the Stop CMV Act of 2023, which was to incentivize hospitals and healthcare providers to screen for CMV in infants before the 3rd week of life. And while the bill has to be formally introduced, it certainly gained quite a bit of buzz. It needs a Republican co-sponsor. We'll see what happens with this. The essence of the bill, in addition to promoting awareness, looks to provide funding for HRSA, approximately $10 million over 2 years, the CDC, approximately $2.5 million over 2 years, and the NIH, approximately $1 million over 4 years, to work in building data collection systems, giving grants for states to administer tests, and to invest in technology that will lead to better treatments for both the diagnosis and management for congenital CMV. Each day brings new conversation. Each day, unfortunately, brings new children who are diagnosed with this entity. I know that we have a wide audience, and I would certainly encourage you to connect with those in your state to ask what is happening in the space of congenital CMV.